Pacerone is a medication used to treat certain types of serious irregular heartbeat, such as recurrent ventricular fibrillation or tachycardia. It helps restore normal heart rhythm and maintain a regular, steady heartbeat. Pacerone is known as an anti-arrhythmic drug, and it works by blocking certain electrical signals in the heart that can cause an irregular heartbeat. When taking Pacerone, it's important to follow your doctor's instructions carefully. The dosage will depend on your medical condition and response to treatment. It is usually taken once or twice a day, with or without food. It's best to take it at the same time each day to help you remember. Be sure to continue taking Pacerone even if you feel well, as it is often used to control irregular heartbeats, and stopping it suddenly may make your condition worse. If you have any concerns or questions about taking Pacerone, be sure to talk to your healthcare provider for more information. Before you start using Pacerone, make sure to read the medication guide provided by your pharmacist and consult your doctor or pharmacist if you have any questions. Take Pacerone by mouth as directed by your doctor, usually once or twice daily. You may take this medication with or without food, but it is important to choose one way and take this medication the same way with every dose. It's important to avoid eating grapefruit or drinking grapefruit juice while using Pacerone unless your doctor or pharmacist says it's safe to do so, as grapefruit can increase the chance of side effects with this medicine. The dosage of Pacerone is based on your medical condition and response to treatment. Your doctor may direct you to start this medication at a higher dose and gradually decrease your dose. It's important to follow your doctor's instructions carefully and not to stop taking this medication or change the dose without first consulting your doctor. Make sure to tell your doctor if your condition does not improve or if it worsens. Some common side effects of Pacerone may include nausea, vomiting, constipation, loss of appetite, shaking, or tiredness. However, many people using this medication do not have serious side effects. It has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. You should tell your doctor right away if you experience any serious side effects, such as easy bruising/bleeding, loss of coordination, tingling/numbness of the hands or feet, uncontrolled movements, or new or worsening symptoms of heart failure. Additionally, seek medical help immediately if you have any very serious side effects, including faster/slower/more irregular heartbeat, severe dizziness, or fainting. Amiodarone may rarely cause thyroid problems, and it may also cause your skin to be more sensitive to the sun. To help prevent skin effects, limit your time in the sun, avoid tanning booths and sun lamps, use sunscreen, and wear protective clothing when outdoors. If you notice any vision changes, such as seeing halos or blurred vision, tell your doctor right away. A very serious allergic reaction is rare, but seek medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice other effects not listed, contact your doctor or pharmacist. If you experience any side effects, it's important to discuss them with your doctor. Pacerone, also known as amiodarone, is a medication used to treat irregular heartbeats. It can provide great benefits for people with this condition. However, it's important to be aware that Pacerone may rarely worsen an irregular heartbeat or cause serious, sometimes fatal, side effects. When starting treatment with Pacerone, your doctor may have you stay in the hospital for proper monitoring. It's important to note that Pacerone may take 2 weeks or longer to have an effect in your body, and it can stay in your body for weeks to months even after you stop taking it. Serious side effects, such as lung or liver problems, may occur weeks to months after taking Pacerone. If you notice any symptoms of lung or liver problems, such as nausea/vomiting that doesn't stop, cough, shortness of breath, chest pain, coughing up blood, dark urine, severe stomach/abdominal pain, or yellowing eyes/skin, it's crucial to tell your doctor right away. It's important to follow your doctor's instructions carefully when taking Pacerone, including the recommended daily dosage and the optimal timing for taking it. Always communicate any concerns or symptoms to your doctor promptly. Before taking Pacerone, it's important to let your doctor or pharmacist know if you have any allergies, especially to iodine. It's also crucial to inform them about your medical history, particularly if you have liver disease, lung disease, or thyroid problems. This medication can make you feel dizzy, and using alcohol or marijuana can increase this dizziness. It's important to avoid driving or using machinery until you know how Pacer1 affects you. Limiting alcoholic beverages is also recommended. If you are using marijuana, make sure to talk to your doctor about it. Before undergoing surgery, make sure to inform your doctors and dentist about all the products you are currently using, including prescription drugs, non-prescription drugs, and herbal products. Pacer1 may cause a condition that affects the heart rhythm, known as QT prolongation. This can lead to serious symptoms that require immediate medical attention, such as fast or irregular heartbeat and severe dizziness. The risk of QT prolongation may increase if you have certain medical conditions or if you are taking other drugs that may cause QT prolongation. It's important to discuss all of this with your doctor before using Pacer1. Low levels of potassium or magnesium in the blood can also increase the risk of QT prolongation. This risk may be heightened if you use certain drugs or if you have conditions such as severe sweating, diarrhea, or vomiting. Make sure to talk to your doctor about using Pacer1 safely. It's important to note that older adults may be more sensitive to the side effects of Pacer1, especially in relation to heart and lung problems. If you are pregnant or planning to become pregnant, it's crucial to discuss the risks and benefits of using Pacer1 with your doctor. This medication may harm an unborn baby, so it's important to use effective birth control while taking Pacer1. It also passes into breast milk and may have negative effects on a nursing infant, so it's not recommended to breastfeed while using this drug. It's important to be aware that Pacer1 can interact with other drugs, which may change how they work or increase your risk for serious side effects. This is not a complete list of all possible drug interactions, so it's crucial to keep a record of all the products you use and share it with your doctor and pharmacist. It's also important not to start, stop, or change the dosage of any medicines without your doctor's approval. Certain products that may interact with Pacer1 include fingolimod and certain drugs to treat hepatitis C, such as ledipasvir/sofosbuvir and sofosbuvir. There are also many other drugs that can affect the heart rhythm, including dofetilide, pimozide, procainamide, quinidine, sotalol, macrolide antibiotics like clarithromycin and erythromycin, and quinolone antibiotics like levofloxacin, among others. There are also certain medications that can affect the removal of Pacer1 from your body, such as azole antifungals like itraconazole, cimetidine, and rifamycins like rifampin. It's also important to note that Pacer1 can slow down the removal of other medications from your body, which may affect how they work. Examples of affected drugs include clopidogrel, macitentan, phenytoin, certain statin drugs like atorvastatin and levastatin, trazodone, and warfarin. If someone has taken too much Pacer1 and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include weakness, severe dizziness, very slow heartbeat, and fainting. It is important not to share Pacer1 with anyone else. Your doctor may require you to undergo various medical tests while taking this medication, including EKG, chest X-rays, lung/liver/thyroid function, and eye exams. It's important to keep all of your medical and lab appointments and consult with your doctor for more information. If you happen to miss a dose of Pacer1, take it as soon as you remember. However, if it's almost time for your next dose, then just skip the missed dose and take your next dose at the regular scheduled time. It's important not to take a double dose to make up for the missed one. Remember to follow your doctor's instructions closely regarding the timing and dosage of Pacer1. When it comes to storing Pacer1, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. It's also crucial to not flush Pacer1 down the toilet or pour it into a drain unless specifically instructed to do so. When the medication is expired or no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.